welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Dr. Priyanka Ahuja, and today I will be talking about complications that COVID-19 can cause in a pregnant woman. Gestational diabetes mellitus is one of the most frequent pregnancy complications with a global prevalence of 13.4% in 2021. Pregnant women with COVID-19 and gestational diabetes mellitus are 3.3 times more likely to be admitted to an intensive care unit compared to women without gestational diabetes mellitus. The study aimed to investigate whether gestational diabetes mellitus is an independent risk factor for adverse maternal, fetal, or neonatal outcomes in pregnant women with COVID-19. CRONOS Study is a registry-based multicentric prospective observational study from Germany and Austria. Data was collected from a cloud-based electronic data platform. A primary combined maternal endpoint was defined as admission to an intensive care unit including maternal mortality and/or viral pneumonia and/or oxygen supplementation. A primary combined fetal neonatal endpoint was defined as stillbirth more than 24 weeks of pregnancy and/or neonatal death less than 7 days postnatal, and/or transfer to a neonatal intensive care unit. Multivariable logistic regression analysis was performed to evaluate the modulating impact of gestational diabetes mellitus on the defined endpoints. Out of 1,490 women with COVID-19, 9.4% were diagnosed with gestational diabetes mellitus. Of these, 42.9% were treated with insulin. In overweight, obese women, however, gestational diabetes mellitus was independently associated with primary maternal outcomes. Overweight, obese women with gestational diabetes mellitus requiring insulin treatment were found to have an increased risk for a severe course of COVID-19. Maternal gestational diabetes mellitus and maternal preconceptional body mass index of more than 25 kgs per meter square increase the risk of adverse fetal neonatal outcomes. Furthermore, overweight or obesity were influential factors for the maternal and neonatal primary endpoints in comparison to women with underweight or normal weight. Researchers concluded that gestational diabetes mellitus combined with preconceptional overweight or obesity is independently associated with severe maternal course of COVID-19, especially when the mothers require insulin and COVID-19 is diagnosed with or after gestational diabetes mellitus diagnosis. Women with gestational diabetes mellitus and body mass index more than 25 kg per meter square are particularly vulnerable group in the case of COVID-19. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.